today we're going to be talking about a client of mine again who was nice enough to volunteer her before and after photos. Now this one, instead of someone who's coming with a full face of melasma, even though she did come to me for pigmentation treatment, we're going to be talking about today some of the age spots that she started seeing, but she also had some pigmentation, and we basically did a treatment where those have disappeared. Now, I do want to say that this video or any of the videos that I do are not medical advice and not for medical treatment. Some of you have commented on the videos that you're seeing success with some of the things that I've done with some of my clients, however, just limited success. You have to remember that each person has very different skin. You're living in different areas. The triggers of pigmentation is also wide and varied. So based on the information that I have, that is what I use to get them started. And the protocol that I start my clients with is not the protocol that they usually end with. Okay? So, hi, for those of you who don't know, my name is Christy and I have been treating clients for over 15 years now with over 26,000 different treatments under my belt. And we're going to be talking about my client that she came to me via a YouTube channel, and her name is Kim. And she is from New Jersey. Now, when she submitted her photos, this photo right here was taken back in August of 2020. Okay, so like with every client, I actually have them fill out several pages of the client consultation form. And one of the questions that I ask them is, what are some of your ultimate skincare goals? So that I can refer back to that, because sometimes in the course of treatment, they change their mind. And so then I say, well, let me remind you, these are some of the things that you expressed to me that was important. And so the protocol was created specifically for your goals in mind. So for hers, she said she was looking for increase in hydration in her skin, decrease oily skin, address fine lines and wrinkles, and even out hyperpigmentation. Okay, now she's in her mid-50s, and her prior skin history is a little bit more complicated than some of the people that are watching YouTube asking me questions. And this is why when some of you ask questions, I always respond back with more questions, because sometimes, depending on the question, I can't answer it just offhand. Okay, so her prior skin history was, she had a history of bad acne. Medications included tetracycline, Retin, clindamycin, Accutane for 3 months, birth control pills, and Differin. She also had been on several medications for breast cancer treatment. Okay, so when we're talking about anything that affects the hormones, that can trigger pigmentation issues. Her background is she's half Korean and half German. And let's see, her treatment history is actually pretty extensive. In her consultation form, she also indicated that she had sinus problems and allergies and psoriasis and eczema. So here we have now some histamine issues. We have some anti-inflammatory issues. She indicated she also reacted in the past to pets, medicine, foods, and skincare products. Now this tells me that her skin is prone to inflammation, okay? And it can even lead to rosacea. So this is going to get a lot of complicated, because we're going to have to introduce some clinical level products eventually, but because she is prone to sensitivities, we also had to take it slow. Now listen to her treatment history. She had acid peels in which she got 3rd-degree burns. It took 2 weeks to heal, including a peel called the South Beach peel. Now this is a combination of broadband light and micro laser peel, quick pulses of light laser. They were all done more than 4 years ago. She started developing more pigmentation, and you can see the age spots close enough. I don't know if it's going to transfer over, but in the photos you can see they almost look like sun freckles here. Now, and these photos, these were the ones that were submitted on August 10th, 2020. Okay, So her initial protocol before the consultation, in the morning, she did, now this is the protocol that she had before she came to me. So it was the Mizon Cleanser, the CE Ferulic, SkinCeutical AGEI Complex, combination of different sunscreens from Clarins and Shiseido, including one from SkinCeuticals. And then in the evening, she added the SkinCeuticals 1.0 cream, alternating with the SkinCeutical Glycoliv 10 Renew Overnight cream, along with the SkinCeutical HA Intensifier. And she had purchased from me the MD Dermaceutical Overnight Repair Cream. Now this is before she did a treatment with me. So as you can see, just by the protocol she was trying to figure out for herself, she was using retinol based products, but that was drying out her skin. So she was also using the HA Intensifier. She was also using the glycolic acid. So if you haven't watched any of my videos, you know that a common thing for hyperpigmentation and for anti-aging is they'll usually pair a glycolic acid, an AHA, along with a Retin A or Retinol based product together, which can increase, it does increase the skin cell turnover rate, but it also can increase dryness. So now the first thing that we did is I actually had her stop all of that because her skin was getting inflamed, and we introduced her to the Age Reverse Brightening Serum. So that was not typically to lighten her skin, that was actually to suppress a lot of that pigmentation formation, but also to reduce that inflammation that she was having. We also had to increase her hydration, decrease her inflammation, just like our other my other client. And the main focus here was the pH of her skin. We had to get the pH right because we wanted to not increase the sensitivity. And so in order to do that, the pH has to be right so that you can get the maximum efficacy of the treatment without having to use more powerful ingredients and layering more and more and more powerful ingredients. So that's what we did there. Because remember, she said she wanted to increase hydration. Some areas were actually more oily, other areas were dry, and then she wanted to address her fine lines and wrinkles and her hyperpigmentation. Okay, so this is what we did to slowly break apart the age spots. And I'm going to go pretty quickly here. So in the morning, we introduced this cross-link astaxanthin serum along with the brightening biopeptide. Okay, then a Lyra hydrating sunscreen and a translucent powder. And the reason why we did the translucent powder is we're trying to balance that shininess, the concern that she had for her nose, her forehead, and her chin. And instead of using the regular rice powder, or they have a lot of fillers like mica and other minerals in there, rice powder actually has naturally occurring anti-pigmenting agents. That alone is not going to do it, but when you're pairing it up with different brightening agents and then you use that, because rice powder has an incredible, it's very intuitive, so that you have when you have dry skin, it actually helps hold moisture in and bring moisture to your skin. In the areas that you're overproducing oil, it actually absorbs the oil. So that's what she's using. And in the evening, she's currently using the Mela Bright Step 2 serum. And she is currently doing the vitamin C post-recovery treatment. Now, because she loves her bread and her pasta, bacon, fried foods, we had her start on the Hush and Hush Brighten. She has now moved towards the MD Dermaceutical Pro Max, and these photos here were taken March 2nd, 2022. So this is fairly recent. And as you can see, most of the age spots that were forming has actually faded. But most of the time that was spent actually was not lightening her pigmentation. It was really to just get that pH right and increase that hydration of her skin. Her protocol also included doing the MyoLift 2 to 3 times a week with recommended serums and the brightening toner. The age spot treatment is slightly different than the melasma treatment. And it doesn't take nearly as long as treating melasma. Now, if you're out there and you have acne spots, dark spots from age spots, or melasma that's forming, or you're in between these stages, you can take the quiz. And based on what you put in the answer of the quiz, we'll tell you just some of the products that may be better suited to your skin. Okay, and they're very general. Now, some of you guys are doing the quiz, but you're not reading your emails. The emails are more individualized in what you can do. And I did that so it's more private and it's not just a general one. So make sure you are checking your emails for that. And if you would like more information on the consultation, I'll put the links below so you can check that out. So if you have any questions on the consultation or the quiz or the treatment, make sure that you look at the description below and go ahead and ask me the questions. So that's it for now, and then we will see you soon on more videos. Okay, remember, makeup is an art, skincare is a science. Thanks for watching.